The neurotrauma program here at University of Cincinnati Gardner Neuroscience Institute is actually quite broad. We have a number of things that range from how we provide care for patients and also how we train the next generation, and also how we do research to help come up with new treatments and new therapeutics. We have a large team that are all committed to really taking care of patients that have traumatic injuries, especially traumatic brain injuries.
I think the Neurotrauma Center is special because brain injury, spinal cord injury, these are the most devastating injuries, and it can happen to anyone, but all those people are able to come to the University of Cincinnati Gardner Neuroscience Institute and receive world-class care. For what other disease, for what other city can you make that kind of statement? You can't. It happens here at the University of Cincinnati.
One of the ways that we set ourselves apart from the other hospitals in the region is we are involved in a lot of national and international clinical trials that help us to provide additional expertise that you can't get anywhere, even outside of the state.
Unlike most other institutions, the research is not siloed from the clinical practice. Here we have a unique translational model which really blends together. Having an integrated campus between the clinical practice and the research is absolutely essential because it creates a culture of collaboration. It's absolutely a key to success.
One of the ways in which we've been really innovative is how we think about improving patient care. So in addition to the standard research and clinical trials that we do, one of the innovative things that we're doing right now is we really are spearheading a learning health system. So what a learning health system is taking the ideas from patients, from caregivers, from the community, combining that with the ideas of physicians, of nurses, of researchers, and really coming together and say, what is the next big thing we need to think about? What are the changes we want to make that are really going to improve patient care? Because of our expertise here at University of Cincinnati Gardner Neuroscience Institute, we are also helping with the national learning health system initiatives that are trying to do similar types of things to improve patient care, but with this sort of overarching view on what is an improved outcome. That's something that is really different, it's really fun to be a part of, and it's one of the things that I think makes us really great here at University of Cincinnati.
I think giving to the Neurotrauma Center is particularly impactful. We are doing things differently through our collaboration, through our breakthroughs in research that are having national and international impact. It's because we are leaders. Another reason is that the Neurotrauma Service really provides a service to all of the public.
Philanthropy that improves the patient experience is really important. One of the things that really matters to us as physicians is making sure that we're providing great care, but it's also important to make sure that patients and caregivers and family members have a great experience throughout the whole thing. By providing philanthropy to increase and improve what the facilities look like is extremely important because that helps the overall patient and family experience, and that helps improve care in its own way.
Philanthropy is so critical to the research endeavor because it helps get us off the ground in new research projects. It's the starting point of long-term innovation. Because if we have high-risk, high-reward ideas, for instance, that a federal institution is not ready to fund yet, those philanthropy dollars can get us started and help us get those vital early pieces of data so that we can convince other funding agencies to invest in that project. So those initial dollars will have a oftentimes 100,000-fold return a couple years from now.
Some of the things that we're able to do in terms of improving patient and caregiver experience, in terms of doing new research initiatives, all of these things are so impactful in not just the patient's lives, but our lives too, as physicians. It's really great to know how much you respect and want to support the work that we do. And I just want to say thank you.